So Molly, what was your moment of revelation when you knew that you were meant to be practicing mind, body, spirit medicine?
Well, I have 2 stories myself.
Only 2?
I have a lot of stories. But the first one was when I was younger, and I was about the same age as your revelation. I had wanted to be a doctor since I was very, very young. Spent all of my time watching the doctor TV shows and reading the doctor books, and had every intention of going into medicine until a family member became very ill. What happened during that time was that instead of dealing with the situation, there was a lot of blaming of the family for what was going on for this one family member. What I saw in the medical community was a loss of the healing tradition that medicine was all supposed to be about, and what I had been spending all of my time since 2nd grade thinking I was going into. Instead, I saw a system that was fairly abusive, and I have to tell you, it really pulled me away from wanting to be a doctor for a very long time. In fact, I left that pursuit and went into psychology instead. That sent me in a completely different direction. I still went with a medical bent. I was into rehabilitation psychology. Then I decided to go back in and do the medicine. I had come to terms with what medicine was all about and how I wanted to practice it. So I did go on, I got my medical degree and went forward with it. Then I had my own medical crisis when I was in the middle of my residency. I had a broken neck and I was paralyzed for a while. My arms were paralyzed. Well, I had been very comfortable before then talking about the mind and the body together, because that was I was a psychotherapist before I became a doctor, so that was very comfortable for me. What was uncomfortable for me was to talk about how spirit played a role. And when I talk about spirit, I'm talking about our connections to ourselves and to the world around us, the people around us, and somewhere along the line to something bigger than ourselves, that bigger picture feeling. Well, I was very comfortable in my personal life, really delving into the spiritual realms, but I was very uncomfortable in my professional life dealing with that, until I had my own medical crisis. And you'd be amazed at how fast those questions come up when you're dealing with your own medical crisis. And it was a pretty rough time. I really went to a dark night of the soul with paralysis. That was pretty hefty, and there was a lot of pain for a really long time. And what I realized in that experience was that I really needed to speak my truth. And my truth was that mind, body, emotions, and spirit were all deeply interconnected, and that they all needed to be addressed. So I took that leap of faith and started talking about that with my colleagues, with patients, not as something to discuss in terms of an agenda. I don't have a religion that I'm trying to push or espouse. What I was talking about is, how do people feel connected to their world and to their life? And what I found was that was a really important question. And a lot of people did want to have that discussion, including other doctors. And I think that's really important to say, that it was not the topic that nobody wanted to discuss. It was a topic that everyone wanted to discuss. And so that really took us into a whole different realm about how we practice medicine.
Well,
The end.